Dr. Walach, good morning, and thank you very much for picking up our call. And I wanted to thank you for everything you do. We have an unusual situation here, and I wanted to ask you an opinion if you could please share with us.
Okay.
We have a young lady, family member, who had some trauma going out through her life, growing up, and she was repeatedly either punched or kicked in the intestine area of stomach and colon. And there is a big possibility that she has either twisted intestine or twisted colon. And we would like to hear from you, how can we identify the right diagnosis, if there is any way to do it without any harmful radiation?
Okay, well, the important thing here is you have to tell me how this past trauma manifests itself. I mean, does she have trouble walking? Is she in a wheelchair? I mean, what has this trauma done to her?
No. She has. She was actually in I believe, in a fight, and she has problems with passing out bowel. She has developed colitis and
okay, so she has constipation.
Related issues. Constipation, yes.
Okay, now wait a minute. Stop. Does she have any history of respiratory problems, any asthma or bronchitis? Do you know?
No.
Okay, does she have any history of skin problems, any eczema, dermatitis, psoriasis, dry skin, rough skin, rosacea?
No.
Okay, but you said she has constipation, and how old is she now?
She's 26. She's about 5'6", and she's about 155, 160 pounds.
Okay, and so no other issues, no diabetes, no high blood pressure, no emotional problems, no depression. Okay, Charmaine, you there?
I'm here.
Okay, here's a 26-year-old young lady, 5'5", 5'6", 160 pounds, and she's constipated. She has a history of colitis. They think maybe from trauma 20-something years ago, from being punched as a kid, she may have a twisted colon. What do you think is going on here?
Well, the obvious thing would be she's got a gluten intolerance.
Mm-hmm. And maybe this being beat up as a kid is kind of a, what should I say, coincidental thing. It really isn't the cause of these problems. Yeah, constipation, colitis goes along with gluten, and being 5'5", a girl, I'd like to see her weigh 135, 140, 160 pounds. She's probably 20, 30 pounds overweight. And so what would you do for her constipation? Let's just start for her constipation. What would you do there?
Well, for that issue, she could start taking the herbal rainforest at night, one thing, or cleanse.
Yeah, she could take the herbal rainforest. At her body weight, I'd have her take a tablespoon, which is a half ounce, so 1 quart will last 2 months. And usually within a day or so, they'll have a normal, comfortable bowel movement on a daily basis. And then, let's see here, what would you do diet-wise to support healing and absorption?
Well, obviously no wheat, barley, rye, or oats, no fried foods, no burnt animal fat, no oils of any kind, and then that alone should help a lot, and it should also help her lose the 20 or 30 pounds.
Mm-hmm. And then what program would you give her to 160 pounds to, again, support healthy physiology, healthy biochemical health, and just her body's want to repair itself? Your body requires 90 essential nutrients to repair itself. Where would you go?
Well, I would go with a healthy brain and heart pack for her issues, and then the vitamin D3. And
and the fact that she is 160 pounds, I'd have her take 2 healthy brain and heart packs a month. You know, if it's not a financial issue, 2 healthy brain and heart packs a month, a full dose of everything twice a day. And as you say, vitamin D3, she can have 3 of those twice a day, 2 bottles a month. And then, of course, it doesn't hurt for her to take the MSM just to support and promote maintenance repair of connective tissue all over, which would include the walls of the intestines and so forth, and colon. And so give us a call every couple of weeks if you would, Ladislav. Give us a call in 2 weeks and 4 weeks and 6 weeks. Let us know how this young lady